I would say yes, it's changed me as a nurse, it's changed me phenomenally as a person. I look at patients quite differently now. I'm very, very aware of how I communicate with patients. I'm very aware of everything I do, my body language, the environment, the adjustments I need to make for people, which I would never ever have thought of before. So it not only changes things for students and patients, it changes things for us as nurses that have been doing this job for ages and ages, and perhaps we need to go back and think again, can we do things differently? It changes you massively, and for the better. I couldn't recommend it highly enough, I really couldn't.
I mean, I think like the main thing is the fact that people are allowing students to come in the first place, because obviously if people don't come in, then that experience isn't going to happen to learn off at all. I think even like the smallest of changes can make a big change for somebody else. For me personally, I think like the most important thing about the Learning Disability Annual Health Check is just creating a positive experience, that someone hasn't left thinking, oh, that was a terrible time and I'm never going to go there again, because then even if they're not facing like a health related issue at that point, it's going to stop them then returning if they have a physical health issue down the line. So I think even the smallest things, that you can just make that a little bit easier, coming to the surgery, or slightly more positive, engaging experience, because you're able to communicate with someone on their level, and for someone to get that feeling that you actually genuinely respect them and you're trying to communicate with them and you're actually interested in what they're going to say. Yeah. I think that's really important, and that people's enthusiasm for that as well. I think being a student, you can portray that as well, where sometimes people aren't as enthusiastic maybe.
These students, and I know they have because there's 4 practices agreed to take them again, they have changed the way practices think. They've challenged things with reception staff, they've challenged things with practice managers, golly, imagine that. They've challenged GPs in a nice way, in an educating way, but that makes you think, doesn't it? That makes you question what you've done for years and years and years, and that's what it's all about, isn't it? It's just about moving us forward and giving new eyes to patients with a learning disability, because they really, really need that focus upon them.